family nurses, this is Vichita. Today I am going to discuss a pediatric condition, that is HIRSCHSPRUNG'S disease. Those who are preparing for nursing licensing exam, whether this is a national or international exam, this is very important topic. So please watch this video completely. So we'll discuss HIRSCHSPRUNG'S disease or aganglionic megacolon. So what is this aganglionic megacolon? That is absence of ganglionic cells in megacolon, that is large intestine. So this is a congenital disorder in which nerve cells are missing in large intestine. So what kind of nerve cells are missing? That is myenteric plexus. So this is a congenital disorder in which myenteric plexus are missing in colon. So what is this myenteric plexus? This is a group of or network of neurons or ganglions which is consisted with synapse network and neurons and neurotransmitters. These myenteric plexus are responsible for movement of colon. Okay, so myenteric plexus are a group of nerve cells which is a part of enteric nervous system. So what is this enteric nervous system? Enteric nervous system or intrinsic nervous system, it is a major part of autonomic nervous system which consists of a meshwork neurons in GI system. So basically this enteric nervous system is controlling the movement, the neurological movement of GI system. So moving back to myenteric plexus, this is a part of enteric nervous system which is normally necessary for the movement of peristalsis. Clear? So that particular myenteric plexus are absent in HIRSCHSPRUNG'S disease. So what happens as a result of this? As a result of absence of nerve cells in colon causes impaired movement of stool. So the passage of stool is impaired. So as a result of this, what happens? The intestinal obstruction, that means the whatever the fecal content that it accumulated inside the intestine because the movement is impaired. So intestinal obstruction will happen. As a result of that, no bowel movement. So I repeat, HIRSCHSPRUNG'S disease or aganglionic megacolon is a congenital disorder in which myenteric plexus, that is nerve cells, are missing in intestine. That is major colon or a megacolon. Fine. As a result of that, the movement of stool or a fecal matter within the intestinal movement is impaired and that causes intestinal obstruction and no bowel movement is expected. So what is the basic sign? That is no bowel movement. What are the signs and symptoms of HIRSCHSPRUNG'S disease? Because of HIRSCHSPRUNG'S disease, it causes intestinal obstruction. So ultimately, because of intestinal obstruction, no stools are moved out. So it causes constipation. Fine. So no movement of bowel and it causes constipation. Fine. And because of increased pressure, the patient will have abdominal cramps. And in order to reduce the abdominal pressure, there may be chances to get diarrhea. Clear? And this particular child is not going to increase weight and the growth and development always reduces and the child may have failure to thrive. Because of increased pressure in intestine, when you observe, the belly will be always swollen. And to reduce pressure, again there may be chances to get vomiting. Okay, so these are the signs. Not only these, apart from that, vomiting causes dehydration, electrolyte imbalance, and abdominal pressure. Increased abdominal pressure causes abdominal cramping and pain. So the child won't be in comfortable manner. So these all are considered as signs and symptoms. But what is the initial sign that can be expected immediately after delivery of a newborn? That is no bowel movement. So immediately after delivery, when you assess, the child will not be having meconium. That means absence of meconium or no bowel movement. That is considered as the classical sign or initial sign of HIRSCHSPRUNG'S disease. And obviously, yes, At the last, there may be chances to get intestinal obstruction and what can be considered as a complications. Because of intestinal obstruction, it causes a rupture. HIRSCHSPRUNG'S disease has two types, that is short segment disease and long segment disease. What happens in short segment disease? The nerve cells are absent in only a short area, whereas in long segment disease, the neurons are absent in a long area. Okay. And next we will discuss investigation. This is also very important for your exam. So what are the investigations? Number one is biopsy. This is considered as a confirmatory test. And then you can perform X-ray, that is barium X-ray can be performed. So barium enema X-rays. Okay, so barium can be used as a contrast to evaluate any structural abnormalities or any abnormalities or to rule out any obstructions, intestinal obstruction in the lower tract, lower GI tract, that is in the colon. Okay, so biopsy is considered as a confirmatory test and X-ray, that is barium enema followed by X-ray is considered as an investigation to rule out complications and to rule out any abnormalities or constrictions in the intestine. And next is manometry. This is only performed in adult, which is not at all performing in children. And what happens in this, normally this manometry is performed to identify the muscle strung around rectum and anus. In this, we normally inflate a balloon inside the rectum, and if that causes relaxation, which is quite normal, but if there is no relaxation, it is indicating a confirmation of HIRSCHSPRUNG'S disease. How do we manage HIRSCHSPRUNG'S disease? Symptomatic management is important to reduce the symptoms. However, surgical correction is the corrective management or a complete curative management. So basically in surgery what we do is bypass or remove the affected part. What is considered as an affected part? The area in which neuron cells are absent. So that particular area need to be removed and remaining colon we consider as normal, and normally the surgery is done through two manners, that is osteotomy surgery and laparoscopic pull-through. So in osteotomy surgery normally we remove the abnormal portion and then a stoma is created. Once the stoma completely heals and the removed portion completely get healed, then connect the healthier portion to rectum and anus. Okay, and in laparoscopic pull-through, diseased portion is stripped away and then the normal portion is pulled through the colon and which is connected to or attached to the anus. These are the two methods of surgery. After surgery, you have to give proper position for the child and vital signs need to be assessed. And immediately after surgery, there are various complications, and one of the major complications is bleeding, so you have to focus on that. And other complications like paralytic ileus and infection. So you have to monitor all those kind of complications and signs and symptoms of complications. And you have to provide antibiotics in order to reduce infections and keep NPO, and meanwhile keeping NPO you have to hydrate the client, and proper hydration and electrolytes that need to be managed well, and psychological support for child and basically for parents, that is very important, and these are considered as the nursing management. So far we have discussed the definition of HIRSCHSPRUNG'S disease, signs and symptoms and investigation types and surgical and nursing management. I hope everything is clear to you, and if you have any queries, please feel free to contact me, and my number is given in this. Otherwise, you can comment all of your doubts in the comment box. Thank you for watching. God bless you all. Bye bye.